So today we are going to talk about a very important topic, and the name of that important topic is CVP. I suppose you have heard about it. If you have, then well and good. If you haven't, it's okay. We are going to cover it today. So, CVP, what is CVP? CVP is central venous pressure. CVP is central venous pressure. Now, what is central venous pressure? So, central venous pressure is, for to understand what is central venous pressure, we have to go back to cardiology and we have to remember about the circulation system. Okay, so let's try and make our own heart. We have right atrium, right ventricle, and left atrium and left ventricles, right? So let's say this is our right atrium, we have right ventricle, we have left atrium and left ventricle, right? So if you recall the circulatory system, you'll be able to recall that superior vena cava and inferior vena cava, they come and they draw blood to right atrium. Okay, they draw the blood towards the right atrium, and in between right atrium and right ventricle we have a valve which is known as tricuspid valve, right? So we have a valve here which is known as tricuspid valve. From right atrium, the blood goes into right ventricle. Understood? From right atrium, it goes into right ventricle. From right ventricle, the blood goes to lungs. The blood goes to lungs through pulmonary arteries, right? Through pulmonary arteries. Now, what happens in lungs? The blood gets oxidized. The blood get oxidized. Now, this oxidized blood get returned to left atrium. Get returned to left atrium through pulmonary veins. And from left atrium, the blood goes to left ventricle. We have another valve which is known as bicuspid valve. So in between left atrium and left ventricle, we have bicuspid valve. The blood goes from left atrium to left ventricle through the bicuspid valve. Now from left ventricle, here arises what? Here arises the aorta. Here arises the aorta, which carries the blood towards the body. Okay. Aorta arises from left ventricle and carries the blood towards the body, and then the whole circulation occurs. Done? Now, central venous pressure is the pressure exerted by the blood on right atrium. On where? On the walls of right atrium. Okay, because we have already seen that superior vena cava and inferior vena cava, they collectively come and they draw all the blood into the right atrium. So the pressure of the amount of blood exerted on the walls of right atrium is known as central venous pressure. I hope it's I hope you are able to understand this much. Okay. Now, moving next, let's talk about what are the normal values of central venous pressure. So, the normal value of central venous pressure is 3 to 8 mm Hg or 5 to 10 centimeter of H2O. Okay. At some point, you can also find it 2 to 6 mm Hg. Okay. Now you need not to cram it. Why? Because in mmHg and centimeter H2, it's very easy. Here's a trick to remember that. 1 mm of Hg is equal to 1.36 of centimeter H2O. Okay. So if a value is given in mmHg and you have to convert it into centimeter H2O, you don't have to do anything. You just have to multiply it with 1.36. Got it? And if a value is given in centimeter H2O and you have to convert the value in mmHg, what you will do? You will simply divide the value by 1.36. Okay. Now coming back on the topic, we have discussed that normal value of CVP is 1.36 is 2 to 6 mmHg or 3 to 8 mmHg or 5 to 10 centimeter of H2. Good. Now the question arises, why do we need to measure the CVP? What do you think? Why? Why do we need? Why is there a need to measure the CVP? We are measuring the CVP to know about the preload of heart also. Because see, the superior vena cava and inferior vena cava are combining into right atrium. The amount of blood is combining into the right atrium, which is also known as preload. Hence, with preload, what else we are getting to know? With preload, we are also getting to know about the amount of fluids. Amount of fluid in our body. Is it increased or is it decreased? Isn't it? We are with preload, we are also getting to know about the amount of fluid present in the body, whether it is increased or whether it is decreased. How? Because see, if the superior, if we have, suppose if the patient is dehydrated, right? So inferior vena cava and superior vena cava they will have less amount of blood, right? And they will carry less amount of blood and that less amount of blood will pool into right atrium. So the central venous pressure will also be decreased. So if the central venous pressure is decreased, it means the patient is dehydrated, right? So now let's see what are the conditions in which the central venous pressure is increased and what are the conditions in which the central venous pressure is increased. We already know the correct value, 3 to 8 or 2 to 6 mmHg or 5 to 10 centimeter of H2. Now let's see, when will it increase, the CVP? When will it increase? What do you think? Okay. See, the CVP will be decreased when we have right sided heart failure. Why have I wrote it down? right-sided heart failure. Why? What will happen? Yeah, obviously, the right side of heart is not functioning well. So in the right side of heart, we have our right atrium and right ventricle. Now, the right ventricle is not working properly. So all of the blood is going to pool into right atrium, right? See, there are two conditions. What will happen? The blood, which is there in right atrium, is not moving forward towards the right ventricle. So the blood will start pooling in right atrium. Good enough? Okay. Now, okay, let's see, right atrium is working very properly, but now right ventricle is not working properly. So the blood was supposed to go into lungs through your pulmonary artery, but now the right ventricle is not working properly. So the right ventricle will not pump blood into right atrium. Again, the blood will start pooling into right ventricle, right side heart failure. Okay. And another condition which will increase the pressure in right atrium is when there is problem in pulmonary artery. In where? In pulmonary artery. Maybe there is some sort of embolism. So if this is the pulmonary artery and I have an emboli here in the pulmonary artery. In the pulmonary artery, I have an emboli. So my right atrium is working very nicely. My right ventricle is working very nicely. But because of the emboli, because of the embolus, my blood is not moving forward to the pulmonary artery. Since the blood is not moving forward, everything is going to pool in right ventricle. And because of the pressure, the flaps of your trigeminal, your valve will move in the upward direction and blood will flow again from right ventricle to right atrium. Hence, the pressure in right atrium will increase. Okay, so now let's see what all we have discussed. Right side heart failure we have discussed. We have discussed if there is pulmonary embolism. Pulmonary embolism. In that case also, right? Then if there is fluid overload, if there is fluid overload, the pressure, the amount of blood is going to be increased. So if the amount of blood is increased, then the pressure exerted by the blood on the valve, on the valve is also going to be increased. So in these cases, the CVP is increased. Now let's see what are the cases in which the CVP is decreased. The cases in which CVP decreases. So CVP decreases when there is dehydration. When there is dehydration or there is hypovolemia or there is hypovolemia. So in these two cases, for example, the patient is having diarrhea, the patient is dehydrated. In this case, the amount of fluid is going to be very less. So if the amount of fluid is less, the pressure exerted by that fluid is also going to be less, right? So if the patient is dehydrated, we can say if the patient is having loose motions, diarrhea, etc., etc., right? And again, if the patient is hypovolemic, for example, if the patient has anemia, in that case also, the amount of blood is going to be very less. So the pressure exerted by that amount of blood on the wall of right atrium is also going to be less. Understood? Okay. Let's move forward. Now let's see what are the equipments by which we will measure the CVP. Okay, what are the equipments by which we measure the CVP? So to measure the CVP, we need normal cell line. Then we will need IV lines. Then we will need a CVP manometer. CVP manometer. So what is a CVP manometer? CVP manometer is a device on which you will see the CVP. Okay, we'll have pictures ahead. We'll see in pictures also. Then we will be needing a three-way stopcock. Okay, and most importantly, we will be needing a central line. We will be needing a central line. Through this central line, we are going to induce our central venous catheter. We are going to induce our central venous catheter. Now, what are the routes or what are the places in which we can insert a central line? So, the first and firstmost is subclavian vein. It is subclavian vein. First priority. Okay. And if any case the subclavian is not accessible, then you can go to jugular. You can go to the jugular. So these are the routes. Okay. Now let's see about the position. What is the right position to perform the procedure? Okay. So the first position is supine position. You have to make the patient lay down in supine position and there should be no pillow. No pillow. Okay. We will learn why we need to make the position lie down in a supine position and why don't we need a pillow. Understood? Now, if the patient is not cooperating in the supine position, then there must be some other position in which we can place the patient, right? So the other position is semi-Fowler's position. Semi-Fowler's position. Okay. Semi-Fowler's position. Okay. Now, let's see what are we going to do with the patient. Okay. So, if you can see in the first picture, right, we are here. These are the equipments we will be needing to measure the CVP with a manometer. Okay. This thing is, first we have NS with stand IV line. Then we have this thing which you can see. This is called as manometer. This is called as manometer. This is your three-way stopcock. And then we have one central line catheter. We have central line catheter. Now, these are the equipments. Now, we were talking about the position of the patient, remember? So, in position, we have talked about we have to keep the patient in supine position without any pillow. Now, why we are focusing on keeping the patient in supine position? Okay, because we have to find mid-axillary line or phlebostatic axis or phlebostatic line. Now, what is this? This is nothing but simply, see, this is our patient. Let me zoom in on our patient. So, to find a phlebostatic axis or mid axillary line, what we have to do is we have to find out the fourth intercostal space of the patient. 1, 2, 3, 4. So fourth intercostal space of the patient, and if this fourth intercostal space and an imaginary mid axillary line and an imaginary mid axillary line. Okay. Now there must come a point where your fourth intercostal space line and your imaginary mid axillary line are going to intersect. They are going to intersect. Okay. So this point where your fourth intercostal space line and your mid axillary line are intersecting, this particular point is known as phlebostatic point. Okay, this particular point is known as phlebostatic point, and the line which is going through this axis is called as phlebostatic line or mid axillary line. Understood? Now, why are we so focused on this phlebostatic line or mid axillary line? Because when the patient is in this position, we assume that our heart is at this position. And during the procedure, we have to adjust the manometer. We have to adjust the manometer on patient's phlebostatic axis or phlebostatic line. Okay, you can see the manometer is also on the same axis as of that patient's phlebostatic line. Okay. Now let's see about the procedure. How the procedure is done, what we all need to do. Okay. So the first thing is measuring the CVP while using a manometer. Okay. So first we have given supine position to the patient. We have adjusted the manometer. We have founded the phlebostatic axis also. And we have adjusted the patient on the manometer on patient's phlebostatic line also. Okay. Now what we have to do is this. We have to attach the NS to the manometer. Okay, we have to attach the NS to an IV line to the manometer. Okay, now what will happen? First of all, you will flush the manometer. You will flush the manometer. Okay, then after flushing the manometer, what you will do? You will open the three-way. You will open the three-way between NS and your manometer. Between NS and your manometer. What will happen? NS will start drawing towards the manometer. Okay. NS will start drawing towards the manometer. You will start seeing the NS level rising here. Okay. And you have to let it rise for at least 20 centimeters. How much? For at least 20 centimeters. We have a red dot here in the manometer. Manometer is nothing but a scale. Okay. In which the NS goes upward. So we have a red dot in this manometer, and the red dot will also move, the red dot will also move upward, right? Now, when 20 centimeter is done, you have to stop it. You have to stop the stopcock. You have to switch off the stopcock between NS and manometer and switch on the stopcock between manometer and the patient. You can see it is on. It is on between NS and the manometer. Now, when we have seen now that, okay, the NS is 20 centimeter, we are able to see the NS has risen up to the level of 20 centimeter. Now we will stop this. We will turn it off and we will turn it on the side of patient. Now the stopcock is on between manometer and the patient, and it is off between NS and manometer. Understood? Now, since it is on between the manometer and the patient, the NS will start coming down. The NS, which was there in this manometer, will start coming down. Okay? Now, there will come a point when the NS will not go any further down. There will come a point where the NS will stop at a point and it will not go any down further. That particular point on which the NS has stopped is your CVP, central venous pressure. Okay. Now, since the patient is alive, the patient will be breathing. And when the patient is breathing, the NS level is going to fluctuate. The NS level is going to fluctuate. Now the question arises, when do we have to measure the CVP exactly? So when the patient has exhaled, and at the end of that exhalation, where the NS is, that is your CVP. At the end of the exhalation, where the NS is, that is your CVP. All right? Okay. Now, this is all about your CVP measurement using a manometer. There's another method of measuring your CVP, which is by using a transducer. By using a transducer, which we will do in next lecture. And with that, we will also continue with CVP waveform, and draw CVP line. I have a picture of CVP line I'll show you. And we will also do with drawing blood through CVP line. Drawing blood through this CVP line. Okay. So what all we have done today is about CVP. What is CVP? Why do we need to measure CVP? What is the normal value of CVP in mmHg and centimeter H2O? And what are the equipments? What is the proper position? And after positioning, we have done why that position is important and the procedure with your manometer, right? Before ending the class, I would like to show you this triple lumen CVC catheter. This is what I was talking about. This is a triple lumen CVC catheter. We have 3 ports in this catheter, and we will talk about this catheter in our next class. Till then, keep learning, keep reading, and I will see you in your next class. Have a nice day.